So if you want the fundamentals, you can find them actually today. Now the other way that nurses learn is the physician method, which is you're probably familiar with, which is the watch one, do one, teach one method, where you watch a physician insert a catheter, then you insert a catheter while the physician watches you, and then you teach someone else how to insert a catheter. This is not a favored way on how to learn for nurses, just because you tend to, you learn by trial and error, and it's preferred that you not learn by trial and error on making mistakes. But this is one of the ways that's still popular in the U.S. to learn. Now, for a lot of facilities that are just learning how to insert catheters, as you go through your training course, you learn the fundamentals, and you start your hands-on. It's not uncommon to go along with a physician to insert with them. Generally, you have to insert something between 10 to 20 catheters before you're considered, I should say 10 to 20 catheters successfully, and then you're considered okay, where you can do it by yourself. It usually takes about 100 insertions before you get to the point where you're considered to be a competent vascular access nurse. Now, certification. Agnes talked about this a little bit earlier. I put the websites up here. So, one is a certified registered nurse of infusion therapy, which is a very broad certification. Everything in infusion therapy, from IV medications to vascular access, to even a lot of aspects of nutrition. Because you get things like parenteral nutrition, total parenteral nutrition, things like that. The CRNI is available to actually literally every single person in this room. If you give an IV medication or insert a peripheral IV, you can sit for this test. The training materials are available online. The only difficult thing is you have to test at certain testing facilities, and you have to go on the website to see where these testing facilities are. The good thing about CRNI is it's a very, very comprehensive certification. It's like when you become a registered nurse and you sit for your boards, you take the test, and it's a way of telling the world that you are minimally competent to be a registered nurse. When you take the CRNI, it's a physical level of evidence that you are an expert within infusion therapy. I would consider the CRNI to be one of the most difficult tests I've ever taken. It was actually more difficult than when I got my nursing license. There's a lot of little things in there. There's a lot of oncology, like I said, nutrition, vascular access, all kinds of stuff. The BAVC, Board Certified in Vascular Access, if you insert catheters, including peripheral IVs, you can become board certified in vascular access. That certification is 100% focused on vascular access. So you learn about all the different catheters, all the different techniques of insertion, all the different complications, and what you do about those complications. It gives you the basic skill set to go up to a patient, assess them, look at their disease state, and be able to say what the most appropriate catheter is and what the most appropriate way to insert that catheter. It's much more it's a much more simple test than the CRNI was. But the nice thing with both of these is these are good evidence to your colleagues, to physicians, and to even your regulatory boards that you are competent and that you have this certain level of basic knowledge that makes you an expert in this field. Any questions on that? That was a lot.
สนใจไหมคะเป็นออนไลน์สอบกันไหมคะ CRNI เขาบอกว่าเทียบกับตอนสอบ Nursing License แล้ว CRNI ยากกว่าเนาะอาจจะลองเข้าไปดูก็ได้เนาะนะคะถ้า CRNI มันจะครอบคลุมทุกอย่างที่เกี่ยวข้องกับการให้สารน้ำเนาะว่าเรื่องของยาเรื่องอะไรทุกสิ่งทุกอย่างเลยแล้วก็ว่ามันยากมากเลยที่ยังไม่เคยเข้าไปสอบกันนะแต่ถ้าเกิดในเรื่องของ BABC เนี่ยจะเกี่ยวกับข้อของ vascular access เรื่องของการแทงนี่การแทงมันคงไม่ใช่อย่างบางทีบางคนเวลาพูดถึงเรื่องของ IVT ไปแทนจะนึกแต่ว่า แทงสำเร็จแค่ตรงนั้น แต่ไม่ใช่นะมันมีเรื่องราวก็มีการ assess คนไข้ถูกไหมคะคนไข้จะต้องใช้คาเทเตอร์แบบไหนถึงจะเหมาะในทำนองนั้นนะคะอันนี้ก็จะเป็นอันล่างเกี่ยวกับเรื่องของการแทงเท่านั้นนะคะการแทงแต่ว่าก็ต้องดูในภาพรวมของคนไข้ด้วยนี่คือ2อย่างนะคะที่ถ้าอยากจะเป็น infusion nurse ที่ส่วนใหญ่เขาจะต้องสอบกันนะคะ Can Thai nurse take the exam?
Yes.
And you said that not only the paper exam, we have to take the practice also, right?
There's no physical practice thing that you have to do. There's a certain experience level that you have to say, like you've been practicing for a certain amount of years, and you have a certain amount of years of experience, but that's it. Now, the challenging thing is I'm not sure where all the testing centers are. I don't think they're only in the U.S.
So we have to fly there
We might
to take
have
the
to fly
test.
to the U.S., which might, yeah. But on the other hand, this is also would be a very convenient time to test for your boards and attend one of the INS, or the bottom certification is for AVA, or the Association of Vascular Access, and you can attend one of those when you also test for this at the same time. And actually, I believe a steep discount on the credentialing and the registration when you're doing combo.
อ๋อก็คือมันจะผูกพ่วงไปกับเรื่องของการประชุมวิชาการใหญ่ๆของคน IB เนี่ยนะคะที่ตัวเองได้เคยไป attend แต่ละปีมันจะมี INS กับ AVA Association of Vascular Access normally INS will be in May right
Yeah.
INS จะมีประมาณเดือนพฤษภาของทุกๆปี แล้วก็ AVA will be in September maybe
Yes.
normally every year เขาก็จะแต่อยู่ใน US เนาะแล้วเขาก็จะมีการสอบอันนี้ผูกพ่วงด้วย ถ้าเราไปสอบแล้วก็ผูกพ่วงกับ register ก็จะได้ส่วนลดด้วยสนใจไหมคะพี่ครู
Now, the interesting thing about this is you don't necessarily have to get these certifications. The education materials to learn them are available online. And you can take these education materials and for your own knowledge, study them and get to know them. But theoretically, INT, is that the
In Thailand we have INNT
INNT could theoretically even start their own certification independently, which is exactly what this organization did. Is this organization, the Association for Vascular Access, was a offshoot of INS. They wanted to specialize in vascular access only. And so if INNT wanted to do their own certification on either or, you could.
maybe in the near future we will do ดีไหมพี่ครูเนาะเราทำของเราเนาะก็คือเขาบอกว่าจริงๆอาจจะไม่ต้องไปสอบก็ได้เพราะเนื่องจากสอบนี่เขาใช้เป็นเขาเรียกว่าอะไรอ่ะเป็นเครดิตของใน US เนาะเอามาเมืองไทยคนไทยก็ไม่ได้พิจารณาเครดิตนี้สักเท่าไหร่แต่ว่าเราสามารถเข้าไปเรียนรู้ออนไลน์เขาจะมี education material ให้เราเรียนรู้เพื่อที่จะเตรียมตัวไปสอบอันเนี้ยเราสามารถเข้าไปเรียนรู้ได้เนาะใช่ค่ะ
Is it different about instinct way?
just a moment
Okay. Is it different about BSI rate between PICC and centralized?
Yes, there are. What's more interesting is there are BSI infection rate differences on not just the type of catheter, but on the location of the body. So some locations, like femoral locations, have a higher infection rate than subclavian insertion. Now, what the leading theory is on the bloodstream infections is it has more to do with the normal flora load on each of those locations and the propensity of them to be moist or not moist. But right now, PICCs generally overall have a lower infection rate than central lines all combined together.
Thank you. And what is the first choice we use when we have to give some grade between PICC and